My name is Manoj Krishna. I'm a spine surgeon and I've been a consultant since 1996. Today I want to talk to you about neck problems and the common causes, and in the second part of this video talk about the common surgery we do for it, which is a cervical disc replacement. So here's a model of our spine, and as you can see we have the head here and 7 vertebrae in the neck. Now, the common cause of the slight ache in the neck or the catch or the crick in your neck when you wake up from a night's sleep is probably linked to muscles which are at the back of the neck here. And these muscles can get weaker, or because of poor posture have to work much harder. So it's really important to do some basic housekeeping to look after your neck. The first of these is to keep an excellent posture so that your neck, your ear and your shoulder are level, so you're sitting up straight. Otherwise, if your head's drooped forwards, your neck muscles have to work so much harder. There are some neck exercises available on our website, and you can download these and do them regularly. If after a course of simple painkillers, including, say, paracetamol and an anti-inflammatory, and doing the exercises yourself, you still have neck pain, then probably that's the time to go see a physiotherapist. And if after physiotherapy you still continue to have pain, then most likely the cause of your pain is a worn disc in the front. Now, these discs are made of a cushion-type material called collagen, and they can degenerate with age. Because there's load being transmitted through the disc, if the disc is inflamed and painful, you will get pain. So often patients say when they put their head back and rest it on a pillow, the pain eases off. But if they're reading or the neck is bent forwards, that's when they get pain. Now, here at the back of behind the disc, you have these nerves coming out at the back of the disc. So if you have a disc that is bulging backwards and it's irritating a nerve, it's going to start causing pain in your arm. In acute disc prolapses, this can be quite severe, and you may need stronger painkillers, including morphine in some cases. The good news is that in 6 to 12 weeks, a lot of patients will have a spontaneous easing of their symptoms with the neck and arm pain. So therefore, in the first 6 to 12 weeks, our main aim is to support you with painkillers and physiotherapy, etc., to try and ease the pain. If after that you continue to have pain, or if your arm starts becoming heavy or weak, then maybe there's a role for surgery. Short of surgery, if you've got chronic neck pain, the other treatment that works very well but for a short period is facet joint injections in the back of the neck. So at the back of the neck are these joints here called the facet joints. And what we do is we come in with a needle and just inject these joints with some local anesthetic and steroid. And that provides pretty effective pain relief. But it may last only 3 to 6 months. Now that's very effective for patients, for example, who've had an acute whiplash injury. About a quarter of patients who present with chronic neck pain have had a whiplash injury of some sort to their neck. The other problem, that the neck can cause is pressure on the spinal cord. It's a condition called cervical myelopathy. Now here, paradoxically, there may or may not be much neck pain, but patients will present with pins and needles in the hands. They might be dropping things with the hands. They have heaviness in the legs, weakness in the legs, loss of balance, but they may or may not have much neck pain. And these patients often have compression of the spinal cord, again caused by a disc in the neck, and they often need surgery to sort it out. So that's just a brief summary of the common neck problems that we see and the treatment options available. In the next video, I'm going to talk to you about cervical disc replacement surgery, which is relatively new and is now probably the preferred operation of choice for the majority of patients who need surgical intervention.